The most important message in regards of cancer is every cancer is curable. There's not one single form of cancer that's not curable, and we all need to understand how simple and easy it can be. Nearly every cancer I know, every cancer I have seen, every patient I have seen could have been cured in 2 to 6 weeks from her or their cancer. And this is what my message is today. When my new book is called The Only Answer to Cancer, and this hour is called The Only Answer to Cancer, and at the beginning, I like to explain to you what I really mean by the only answer to cancer. Because there can be only one single answer to your individual cancer. This is the main message. The same technique, the same therapy form that worked for somebody else will not work for you. And what works for them does not work for anybody else. To make this easier to understand, if somebody has a headache and this person takes a headache pill and the headache goes away from that pill, the same pill doesn't cure the headache in everybody else. Because in some person, the headache is caused by a spinal problem. In the other person, by toxemia, by too many poisons in the system. The next person is dehydrated and has a headache. The other person has stress and has a headache. So every single person has a completely different root cause for his or her own headache. The same is true for cancer. Every single human being has the exact, has his only, absolute only reason or root cause for his or her individual cancer. That is why people ask me, out of these 300 natural cancer cures that are known being effective and safe, which one is the best one? There is no best one. There's just one that works for you, and there's another one that works for the next person. It all starts with the big lie that cancer is a disease or illness. It is not. Cancer is not a disease. It is not an illness. It's the accumulation of different symptoms that they call cancer. And they give it different, complicated sounding nicknames. They give it nicknames that are based on Latin or Greek or Spanish roots. And this is where the problem starts. They act like when they tell you you have a certain kind of cancer, and it sounds impressive and scary, they imply to you they know what you have, why you have it, how it developed, and what to do to get rid of it. But that exactly is not the truth. So basically, if you understand that your medical doctor does not know why you have cancer, where your cancer came from, and how to cure it effectively. The medical profession has a very criminal way of faking statistics and lying to you. The cure rate of cancer is measured by the medical profession in survival rate of 5 years after diagnosis. So if you are diagnosed with cancer and you are still alive 5 years later in 1 hour, even if you die 2 hours later, you're in their statistics as cured. Even if you start dying the same day they diagnose you and barely make it through the 5 years, if you are still alive in 5 years in their statistics, you are cured. The medical profession, Dr. Simoncini, the great cancer doctor from Rome, Italy, stated very simple and clear, and he's an oncologist, and he is curing cancer patients simply with sodium bicarbonate, with baking soda. That's all he uses for over 20 years to cure cancer patients. And I come back to that in a moment when I come back to the individual ways of curing cancer. But Dr. Simoncini says the medical profession has maximum a cure rate of 2%. 2%. And that means that these 2% are still alive 5 years later after the first diagnosis of cancer. I know from personal research and from my colleagues that about 24 to 27% of all cancer patients that do absolutely nothing get healthy again. So if they fall in the hands of the medical profession, they kill at least of these 24 to 27%, 22 to 25% extra. People that had never had died before anyway. Then there is a stupidity and lie of early detection. Mammographies, for example, have never prevented anybody from getting cancer, prevented anybody from dying, anybody from surgery. It gives them only the opportunity to deal with you earlier and to make money on you longer. Because what they do will not prolong your life. There is no statistical evidence. There are no studies. There are no facts out there that early detection saves lives, prevents you from surgery, from losing your breast, or anything else. No, mammographies cause cancer. And the pressure on the breast of a woman doing mammography is about 50 pounds of pressure on the most sensitive tissue in the female body. And that means that if you have a lymph node that's not right, that's full with toxins, that may get cancerous along the way, and they put the pressure on it and it bursts, or it leaks through minor injury into the system, you have full-blown cancer because of the pressure they put onto your body, onto your breast, onto your lymph node. Every time you get an X-ray, every time a woman gets a mammography, she gets her cancer risk up 2%. Every single mammography enhances your cancer risk 2%. And on top of it, even if they find cancer, which they usually don't, they have no way of curing you. So what in the world does it do? It brings them money. They make more money on diagnostics than they make at the moment on treatment. And the early detection and the early diagnostic techniques are nothing else than recruiting techniques to recruit customers. So it's nothing else than creating customers.